Hello, I'm Lew Goldstein, and welcome to another edition of Healthwatch. Tonight we'll be talking about dental care and dental health, and my guest is from right here in Cranford, Dr. Jayshree Sawhney, who is a dentist and opened up her practice right here in Cranford called the Cranford Dental Arts. So, Doctor, welcome to the show.
Thank you. Thank you, Lou.
Well, we have a lot to talk about today. I know there's a lot of people out there who, have worried about dental care, especially during the pandemic, and making sure that their teeth are in good health. And we'll get to all those, potential questions in a little bit. But first, I want everybody to know a little bit about you. So, in 2001, Dr. Sawhney graduated from Howard University's College of Dentistry in Washington, D.C. She then opened a private practice in nearby Maryland, where she worked for 9 years. Dr. Sawhney sold her Maryland practice in 2010 and moved to Switzerland. While in Switzerland, she continued her dental education and familiarized herself with cutting-edge European technologies. In 2012, Dr. Sawhney returned to the United States and joined the staff of Holistic Dental Center, which is in Millburn. In 2019, she decided to open up Cranford Dental Arts right here in Cranford, and the practice provides patients with a comfortable and safe environment for dental care. Dr. Sawhney is one of the first few dentists to own and use CEREC, which is a 3D milling digital imaging device which helps to diagnose any infections to the nerve or jaw in a patient's mouth. She's also been certified as an Invisalign provider for more than 20 years. At Cranford Dental Arts, Dr. Sawhney listens to each patient and provides comprehensive care that focuses on not only oral health, but the overall quality of life. As a mother of 3 daughters, she enjoys teaching children the importance of taking care of their teeth. It's her goal for patients of all ages to enjoy going to the dentist. Patient feedback has highlighted Dr. Sawhney's friendly and warm personality, as you'll see during this interview, which helps patients feel relaxed throughout their visits. She values building lifelong relationships with each and every patient, and she tailors care towards their individual and specific needs. So, Dr. Sawhney, again, welcome to the show.
Thank you.
And I thought maybe we'd start. We're still in the midst of the pandemic. The last 2 years have been, very brutal, for many, many people, both locally and nationally and worldwide. And a lot of people have put off a lot of things, dental care being one of them. Mm-hmm. So I thought I'd ask you first, what has your experience been, with dental care during the pandemic, and what have you been seeing?
So this is a really good question, Lou. I mean, the biggest problem we saw was when the pandemic happened, obviously everybody was nervous after that Wall Street Journal article came out that dental offices were the biggest transmission places, and people were really nervous about that. Right. So people basically stopped going to the dentist. In my opinion, it's been a huge mistake. Because I think dental offices are actually one of the safest places as long as all the precautions are taken, the way they're supposed to be taken. It has hurt a lot of patients by putting off treatment. So treatment that was a small filling, now all of a sudden after the pandemic, because they haven't been to the dentist in a year or two, has become this huge, issue where either they lose the tooth or we need thousands of dollars of treatment. So, my thing to all the patients are, look, offices have really taken precaution. All dental offices, even before the pandemic, we took great care in how we served our patients, how we cleaned the rooms, how we cleaned the air. And after the pandemic, we've, implemented a lot of different things like air purifiers with UVC light, fogging the clinics, also placing, extraoral suction units. So there's a lot of equipment that we've invested as dentists to make sure, the place is safe for patients. We haven't really seen any transmission in dental offices as much as they had predicted earlier. So a lot of the transmission was actually from the outside, and then it was brought, into the office space or things like that. But I think the pandemic has put a wrong being that we shouldn't go to dental offices. I think patients should go back because a lot of issues with patients who are already ill or have autoimmune diseases have infections now all over the place. And so this has led to, a lot of concern because, patients think, oh, it's infection just in the mouth, but that infection in the mouth is creating all these cascading effects of what that could lead to the rest of the body. It's quite serious. So I don't think patients should put off seeing dentists. I think it's very important. It's the entryway to the body. So if you keep putting it off, it can lead to a lot more serious issues. You can request, like one of the things we tell patients is you can request to be seen either first thing in the morning if you're concerned about, anything, or we can create special, situations where patients can just bring their family and we can see their family in that time slot. So there's a lot the dentist and your dentist can work with you. So I think you should not put that off.
Okay. Now, in the introduction, I mentioned things like CIRAC and Invisalign. So maybe we can, tell the viewing audience a little bit about what CIRAC is, because you've specialized in that, as well as Invisalign.
So this is a really good question also. There's so much, Lou, new technology coming out in dentistry, like anything else. Some people are scared of technology, but technology really helps us. It makes us diagnose things better. It makes us better clinicians. It gives us a lot more data that we didn't have from just 2D images. Now with 3D imaging, we can just see so much more. We can actually, before placing an implant, we can actually see exactly where all the vital, vessels are, like your nerve, your blood vessels, and so we can place the implants also more precise. We can do a better job with it. With the CEREC, it's 3D imaging. Now with digital impressions, patients who are gaggers, who don't like all that stuff, gooey stuff in their mouth, we can use a camera, and the camera picks up images and gives us, the lab, the data they need. So it's so much easier, so much better for patients. And the CEREC actually mills it in the office. So you can actually mill, like if you're missing a part of the tooth, we can actually mill it and get it to you faster than in the olden days where you had to wait months to get any piece back or a crown back. So there's much more. Digital age is just making everything faster and more precise in dentistry. And then Invisalign, most people think, what is Invisalign? Invisalign's braces, right? It's the clear braces. I really think if you're going to go for braces, go to your dentist. I don't believe in these online things. I'm not putting any company down, but I really feel, yes, everybody wants perfect teeth, everybody wants straighter teeth, but you also have to see what's your bone quality, how's your dental health. Don't just go and order these things without knowing if you're healthy, if your bone's healthy, are you a candidate for it? And with Invisalign, patients again thought, oh, braces is just for straighter teeth, but it's more than that. It's now we're getting into where patients have sleep apnea, they have breathing issues. By aligning the teeth correctly in the right position, there's so much more we can do for patients, is help them with, MDs, obviously, sleep study doctors that we would work with, and we can put the patient in better position so they can breathe better, their quality of life changes. There's so much more a dentist can diagnose than just teeth and decay. There's a lot more studies coming out. There's a lot more information coming out with 3D imaging, with Invisalign, just amazing stuff. And every day, I just get more and more excited to learn more and more new things, because everything I learn, I can provide to my patients, and my services become better.
Well, I know one of the things we talk about why people put off maybe going to the dentist is because there's a concept that it's no fun to go to the dentist, and there's a concept that it's going to hurt. Okay, so is it going to hurt? I know from the dentist perspective and the patient perspective, there's always a fear that it's going to hurt. So will it hurt?
So one of the things I love specializing in, because I'm the biggest chicken on earth, so I love working with patients who are nervous, who have anxiety issues, who feel that they are a little bit, scared. A lot of anxiety in a lot of dental patients comes from the unknown. But I think the more we know, the anesthesias have become better, you don't need a huge dentist standing over your head and doing stuff. There's ways of making everything more comfortable. I don't want people to be scared.
Right.
You know, walking into the door, meeting, for example, our staff, they're very friendly. They calm the environment down. If I know a patient is nervous also, you know, we take extra care. We take extra time with them. We don't do too much. We make sure they're okay. And I think a lot of dentists are realizing that, you know, patients are nervous, patients are scared. So we're trying to take a lot of effort into learning anxieties with patients, you know, especially during the pandemic. You know, the anxiety levels are just huge. So with the anxiety levels, and you know, wearing the mask, and the mouth gets dry with wearing the mask. You know, also with anxiety, the mouth is dry. So we're seeing a huge increase in cavities, which I've never seen in my life.
Really?
We've seen a huge increase in broken teeth, huge issues with TMJ, you know, headaches, all these different issues. So there's so much more coming onto our plate. But at the same token, I love working with nervous patients. They're the best patients because they're scared, but yet they have a lot to do, and we need to work with them one at a time.
Okay.
And we'll get there.
Okay. Now, talking about nervous patients, I've been accused of being a nervous patient myself, you know, going to the dentist. So I know one thing is that, yeah, I think I brush my teeth. I brush my teeth twice a day, and I think I take fairly good care of my teeth. But I noticed that when I go to the dentist, I'm sitting in the chair, and they're cleaning, you know, my mouth and everything like that. I noticed that every time I'm asked to swish the water out, you know, my gums are bleeding. You know, why do your gums bleed even though you think you take good care of your teeth?
So most people think, you know, just brushing alone, and a lot of people don't like flossing. Also, just having the mouth dry, so that's another thing. Some patients, you know, sleep with their mouth open. Some patients, you know, think, oh, I've brushed and I'm good for the rest of the day. But brushing only covers about 60 to 65% of the tooth. You
Right.
need to use adjuncts like, you know, flossing. You need to use a water pick. Like, I think water pick is a great tool. And I think everybody should use it. You know, the correct way, obviously. There are some people that think, oh, I'll put it to number 10, you know, and turn the dial all the way up, and they're blowing everything away. But there's ways of using it. You know, everybody should ask their dentist what they think. I love the water pick. I love patients when they floss. I love also teaching them about how to keep your mouth, you know, a little bit wet, a little bit, you know, kind of, I'm lost.
Yeah.
Anyways, but you know, work with different, like biotin. There's so many products
Right.
on the market that help with dry mouth also.
Okay.
And dry mouth occurs also from, you know, if you have allergies, if you're sleeping with your mouth open, you know, there's no way of saliva flowing. So when all these things happen, you know, the gums can bleed. So it's not only from, some people could have perfect teeth and perfect oral hygiene, you
Right.
know, habits, but yet we see bleeding in those patients. It could be drug induced, you know, medicines you're on. Most patients are on lots of medicines. That could also be a side effect. It could be a side effect of, again, sleep apnea. It could be a side effect of your diet. It could be a side effect of other things. So you have to look at everything overall and see why is that an issue. And that's why it's important to discuss with your doctor, you know, your dentist. It's important to sit down and talk about it, because there's a lot of things we can do to help you reduce that dryness, which would, you know, reduce the inflammation in the mouth.
Okay.
Yeah.
That's good. Very good suggestions, and that's good to know. I'll be thinking about that next time I'm at the dentist too, or maybe before I go. I think one of the things I noticed, though, I was watching some movies,
Yeah.
some old movies. Now we call them old movies. You know, movies made in the 70s and 80s, and like the middle of the 90s too. I noticed the actors and actresses in there, their teeth weren't white.
Right.
They were just normal, whatever color it was. But somewhere along the line, maybe mid-90s and beyond, you notice that all the actors or actresses, all their teeth are all white and they all look perfect. And I think that spurred a generation to desire to have, you know, either perfect teeth or white teeth.
Right.
That was considered to be healthy if you have white teeth. I don't have white teeth, but, you know, I'm from another generation. But I guess my question to you is, for those who are really focused on wanting to have, white teeth, how can a person keep their teeth whiter?
Right. So, discoloration is natural. We all eat different foods, our diets are different, we drink different liquids that are different colored. Some sort of coloring is normal. We have the whole generation that was on tetracyclines, and, tetracycline, the antibiotic, gave patients also certain discoloration. There's a lot of variables that could cause why your teeth discolor.
Right.
However, having whiter teeth, there are extremes. There's extremes where patients keep whitening every day and every week and then actually damage their enamel. So again, I tell patients, if you're going to whiten your teeth, it's great. It builds up the confidence of people. Some people just want everything perfect, and more with social media and everything, the whole generation is becoming to a point where they want everything whiter, everything lighter, everything, the skin to be perfect, their teeth to be perfect, the bodies to be perfect. So yes, to a certain degree, yes, use the online, again, the stuff you can find over the counter, but always discuss it with your dentist.
Right.
It's better to do it the right way. Like anything else, the mouth is not a separate piece. You have to be careful what products you're using. If you over whiten, you can also wear off your enamel. I've seen that in certain cases. Some people will use pumice. Some people will use charcoal. So be careful what you're using. Always discuss it with your dentist.
Right.
Whitening, obviously discussed with a professional, is better because then they can guide you exactly the right way to do it.
Right.
But whitening is safe if it's done correctly and if it's done in the right, directions, obviously. And it boosts a lot of people's confidence. It boosts a lot of people the way they feel about themselves. And it's so important if patients are feeling a certain way and they just want to boost a little bit, it helps them. And I've seen, teenagers who want to whiten and they come in and we do it the right way and, their confidence just goes amazing. So it's like, you have to see, obviously each
Right.
person is different. Each one's staining is different. We have to see what's causing an issue and then determine from there. But always discuss it with your dentist, what you're doing, how your gum health is.
Right.
Because some people can have very sensitive teeth and you don't want to start whitening those areas because they will become worse. So, you have to be very careful what products you pick, how you do it. If you are a candidate to do it,
Right.
not everyone's a candidate to do whitening.
So not everybody can put the white strips on their teeth,
Right.
or other measures too.
So if you have gum recession, for example, and those areas are sensitive to begin with, and then
Right.
you try to whiten them, you can cause yourself a lot more damage. So you have to be careful. And also how much you whiten. It can also hurt your gums. If you're putting a lot of hydrogen peroxide on your gums, you have to be careful. So I would always say discuss it with, a dental professional and do it the correct way.
Okay. A lot of times a patient will be in the chair, in the dentist chair, and they'll be asked they'll be told that you need to take impressions of a patient's teeth. Could you explain the need why you need to take impressions of teeth and why sometimes you have to follow up with another set of impressions?
So that's a very good question, Lou. So, again, we're moving towards the digital age. So, before you had to put all this gooey stuff and take the imprint of your teeth, this would give us a replicate of what we're seeing in your mouth. So a lot of times, depending on the patient's, what we're doing with the patient, we would want the models because the models show us a lot while you're not there. We can see, okay, Lou needs A, B, and C.
And D, E, and F. Yeah.
And D, and F. But now with digital scanning again, we have the iTero scanner. There are many different brands of scanners. You don't need to put all that gooey stuff. We can actually get a precision impression of your mouth by using digital imaging.
Right.
And what that does is it gives us a look of where you are today. So one of the nice things we do is when a new patient comes in is we scan the patient. It gives us the whole image and also topography study of, okay, how is the patient grinding and clenching and where is he hitting with forces? It's like if you think of 4 tires in a car.
Okay.
Every few months, they recommend we go into alignment. Why do we do alignment? So all the wheels in the car runs efficiently, correct?
Correct.
If one tire is off, then alignment's off and you're going to wear one of the tires worse than the others. Same with teeth. If teeth are not aligned, if they're not in harmony, you can actually create a lot of damage of how your joint sits, your TMJ joint here, how it sits, how it wears. So it's really important to make sure teeth are also in alignment. So the digital impression actually it kind of helps us track you. So if I scan you today and then 6 months later I can track you again and superimpose the images, and with the superimposition of the images I can exactly say, oh Lou, look, this tooth actually moved. So most people think teeth don't move,
right.
But teeth do move constantly, and especially if you have a missing tooth, if you, it kind of narrows the arches. We can see a lot. So digital imaging is just amazing. We can see so much more than we were able to see with just, the old-fashioned models.
Right.
So, it's something, again, we provide in our office. We do, iTero scanning, and we scan every patient, and we kind of keep a track of how they're moving. And it's great to show the patients, because then they see it.
Okay.
Yeah.
One of the things that's very interesting, because a lot of people ask that question about impressions.
Yeah.
And another question a lot of people ask, and I read an article about this, is about diets.
Yes.
And people go on diets for various reasons, all health conscious issues, or the need to, whatever, or the desire to. But there is an effect about when you go on a diet and how that impacts your teeth. And maybe we could discuss that a little bit about how diets impact your dental health.
Yeah, so that's also a very good question. So one of the big things that everybody's doing these days, obviously there's many different diets, right? But they don't understand how this affects teeth.
Right.
So one of the biggest thing people like to drink is kombucha. I don't know if you've heard of.
What's it
There's
called?
a diet, kombucha.
Okay.
It's some sort of drink that's created by growing a certain type of bacteria, and then it's created. A lot of people that think they're vegan or they're on certain specific diets drink these drinks.
Okay.
But if you ever notice the pH of this drink, it's almost between 2 and 3. It's
high,
very, very acidic.
That's very high.
Yeah.
Yeah.
So when something is acidic, yes, it may be great for your gut, but it harms teeth. So the way you consume it, the way you take it in, has to be discussed again with your dentist and see, hey, how do I use this? The same thing with Gatorade, the same thing with orange juice. A lot of drinks we drink, we think, oh, it's orange juice, it's healthy for you.
Right.
But what is it doing to your teeth? But going back to our question about diet, so the reason it's important with diet, because you'll get patients that come in and they're like, oh, doc, I get this bad odor, and I brush and I floss and I clean and I irrigate and I do everything I can, but yet I get a bad smell. Right. So a lot of times it's important to also check your gut health. How healthy is your gut? Is your gut in the right position? So work obviously with either an integrative doctor or work with your doctor and see, is your gut health okay? Are you okay? Is everything okay? Because it's all one, right? It's all one. It starts from the mouth, it goes in the esophagus, and then it goes down to your gut. So all of that is one system. But patients always think, oh, the mouth is a separate portion, but it's not. The diet, depending on what you're eating, how your teeth are. Like some people, you'll see all their teeth are worn out completely. How does that affect how you chew your food? To what particle size do you chew your food? Some people go in alkaline diets, but there's a balance of everything in life. I believe in that. And we see a lot of issues. Some people will go completely off of, carbohydrates and stuff, right, which is fine. They're on keto diets and things like that, but then they're eating more vegetables. So these vegetables are getting stuck in teeth. We see, like, if you have spaces, they're getting stuck all over, and this is where you're going to get infection then, and your gum's going to keep bleeding. So you have to make sure you clean it really well. You clean all that stuff out. Mm-hmm. Also with carbohydrates, some parents think, oh, the goldfish or little crackers are fine for my kid, but it's important to rinse that out.
Okay.
because that all sits in their baby teeth, and kids are not good about flossing. Look, I'm a parent. I know it's hard. It's hard to get your kids to
Right.
do what you want them to do. So when all these food groups get stuck in there, then it's really hard, because that's where kids are going to get cavities. Also about juices that we think, I prefer to give children fresh fruit instead of juices, because it's easier to clean out. It doesn't sit in your teeth, versus juices become more acidic.
Right.
So it's worse for your children.
Is it more acidic if you drink it through a straw rather than just through a glass?
No, straw's better. Straw's
Okay.
obviously better. However, for children, I always say dilute the juices, dilute them with water.
Okay.
And then after they drink the juice, just have them sip it quickly or drink it quickly versus sipping throughout the day, because that's worse. So have them just drink it and then have them rinse with water or drink water after that, so it dilutes the acidity in the mouth. So there's so much we see. Also, patients on, different diets also reduces the salivary flow. So you have to see how the saliva flows,
Okay.
because that's important again. And if they're especially on medications, depending on some medications, the side effect is dry mouth. So you have to make sure, the mouth is not dry. So there's so much with different nutrients. You see, people on different supplements and things like that.
Mm-hmm.
How are the supplements working? Make sure you go to somebody who knows how these supplements work. Because a lot of people take supplements, wrongly. Like,
Right.
for instance, you and I discussed the vitamin D story.
Right.
So not everybody can take D3. Not everybody.
Right.
You have to make sure with your physician that you are a candidate. It's okay for you to take it. So there's so much that it's hard to kind of consolidate. And but if you ever want to come, we can discuss further and go from there.
One of the questions I want to ask you, that is, I think it's important. I mean, people have come to a conclusion sometimes, or they prejudge sometimes, and they think about going to a dentist and they think about the cost, and they say, really, why is it so expensive to go to the dentist? Why is it so expensive to go to the dentist?
Yeah. I mean, the cost of materials, dental materials and everything in this day and age, and with everything rising,
Right.
it's just going crazy. The cost of something like a small filling tube is $100 to $120. That's just one thing we're using.
Right.
Also labor, as you know, is going higher, right? So paying assistants, paying the hygienist, paying all these people, it's very costly. To run a dental office, it's very, very costly. However, we want to give the best to patients, right? We want to give the best. So yes, can you find products that are cheaper, that are made in other countries that are not FDA approved? Yes, there are things like that, but we can't do that. We have to use everything that's FDA approved, everything that's made in, within those clinical data that we are given.
Mm-hmm.
Also, one of the things I like to look at is I don't just use one thing for everybody. I want to see, okay, this patient is allergic to this, or this patient is, has an effect with this. What's the safest material I want to use? What is the company I really want to make sure this company is backing me and backing my patients if something happens, right?
Okay.
Because we are putting something artificial, so we need to make sure everything's safe for you. And yes, the cost of dentistry is high, but there's ways we can work with you. There's Care Credit now, third-party lenders that we can use. We can do stuff slowly. It's better to do work slowly than doing nothing.
Okay.
Because a small cavity is just going to get bigger and bigger and bigger, and then it's going to cost you 10 times more.
Right.
So I always tell patients it's better to do one thing at a time. See your dentist, work with your dentist, we'll work with you. We don't want to give you thousands of dollars of bills, if you don't need it. We want to work with you. We want to work one at a time. Let's get you slowly there. And I tell you, one of my best patients are the ones that take a step at a time, and they get, little by little, and we get done. And at the end of, it's such a great feeling both for the patient or for me when I see my patient is in perfect health,
Right.
dental health.
Okay.
It's just a great feeling.
That's good. So now there's an answer to why it's costly.
Yeah.
Especially without health insurance, is very costly. I know one of the things that I think of when I go to the dentist and I'm sitting in the chair is a lot of times the first thing that the hygienist will want to do is take scans of my teeth. They'll say bite down, hold it. You'll hear the click go on. So can you tell us a little bit about what you look for in any X-rays or scans that are done on patients?
So X-rays give us a lot of detail that we can't see inside, right? We can see with our eyes what we can see, but through teeth we can't see.
Right.
So the good news about digital X-rays versus the old-fashioned X-rays where they had a film and then they had to go dip it and wait for it. With digital X-rays, the amount of radiation one gets has been lowered down a lot. Usually the full set you get when you go on your first visit, it's like going outside for a day in the sun. So they've become so much safer and better and faster. And it gives us, we need that to diagnose a problem. Sometimes a cavity won't show outside till it's 10 times bigger.
Okay.
So it's important to get this to see if there's any infection in the bone, if there's, how bad is the decay, if there's anything else going on, into the bone, if somebody has some kind of defect or something like that, we can pick up all that stuff. But the X-rays give us a lot of detail. So not only the X-ray, but also the iTero scan when we do gives us a lot of information of how the patient is functioning, what they're doing, and then we put all that together and create a treatment plan for you.
Okay. As far as cleaning is concerned, because that's usually the next step after you get your X-rays taken, a person may be wondering how often should they have a cleaning?
So again, that's a very good question. Insurances, patients have this thing in their head that, okay, it's every 6 months. It's twice a year or every 6 months.
Right.
But it varies from patient to patient. This is an average of what somebody needs. But some people may need it every 3 months. Some people may need it once a year. Some people may need it twice a year, sometimes 3 times a year. It varies, again, from patient's diet, patient's health, patient's dexterity issues. It varies from how, patient's teeth, if they're aligned, if they're not aligned, how their salivary flow is. There's so many variables, again, with that. So it's important to discuss with your dentist. Some people have more buildup than other people.
Right.
And in those cases, especially if you have crooked teeth and you're not getting there, you see this whole bridge of buildup everywhere. Now, yeah, that buildup doesn't bother a patient, but imagine how much bacterial infection it's creating under the bridge, where it's infecting the gum. So you think you're brushing, but you're just brushing over the bridge. So it's important to get that out. So in some patients, I've seen it build, like after we clean their teeth, in 2-3 weeks, we see it build up again.
Wow.
But obviously we can't see them that often, so we put them on a 3-month recall. Some patients will put them on a 4-month recall. Depending on where the patient needs. So this whole thing about, I just need to go every 6 months, that's not for everybody. It varies from patient to patient, but it's important to get this buildup up because they've also seen some of the bacteria as the same bacteria they found in people's blood vessels. So we want to make sure we keep these levels down. We keep everything nice and clean.
Okay. One of the things, just following up on that, also is one of sometimes patients' great fears is that by having a cleaning, sometimes they can get an infection. Okay, doesn't happen too often, but on occasion it does, and that infection can travel to other parts of the body. And what preventative measures are taken so that patients can feel reassured to the best extent possible that they don't have to worry about getting an infection when they're getting a cleaning of their teeth?
So one of the things I always tell patients is it's important to go see the dentist because if you don't see, there's also bigger risks and bigger issues. When you go to your dentist, it's important to give your health history. I give a trick to all my patients. I'm like, write all your health issues on a little piece of paper or a card, like an index card, and write all your medications down. Write all of them down. And I have them laminate that. And every year I'm like, update it. By bringing this to your dentist, so you don't forget a drug, you don't forget the dose, you don't forget what, different issues you have, health issues. This gives us a lot of information. So all my patients keep this little index card in their wallet or the purse, and they bring it, and then I just scan it, and so I know, okay, this is Mrs. So-and-so is going through this, this, and this.
Right.
right? So I get that data, and that's important because if somebody has like a hip replacement or somebody had a pacemaker, these are important because I need to call your physician and discuss with them, do I need to put this patient on any pre-medication before I see the patient? Now, if you forget, if a patient forgets, and that wasn't written in the chart,
Right.
then, there's increased chances of infection because the mouth is full of bacteria.
Correct.
So we have to be careful. So it's very important. So I always educate my patients. I try to tell them, okay, Mrs. So-and-so or Mr. So-and-so, make sure you have a list of all, your conditions, also your medications, always laminate it, put it in your bag. And if they don't have a laminate, we'll laminate it for them sometimes. It's kind of a fun thing to do for them.
Okay.
But it helps them, even if you have an emergency, you end up in the hospital, you have something in there. But it's very important to tell your physician whatever you have and your dentist, because this way we know how to treat you. Do we need to pre-medicate you? Do we need to follow up with you? The incidence is very low, again, but it's always a chance you take with patients, especially if they've had hip replacements or any sort of artificial parts in the body.
Right.
So we have to discuss it with their doctor so we can get clearance from the physician how to proceed with you.
Okay.
Yeah.
One thing I've noticed after going to a dentist is that sometimes after some work is done, I wake up in the morning, the next morning, and my jaw hurts.
Right.
Right. So why does my jaw hurt the day after going to a dentist?
So again, there's many different reasons.
Okay.
One could be, just from where we injected you, because obviously when you use any sort of anesthesia, you're piercing a little bit of the skin and the tissue, so you can get pain from that. Sometimes it's from opening, so the jaw, the TMJ joint, sometimes from opening, the joint can be a little sore too. So like in our office, when I know a TMJ patient is coming, it's something we just got. As I said, I love technology. Right. We got this laser, and it's a diode laser, but the laser helps. We put it on a setting where it activates the mitochondria in the cell, and it's like the powerhouse of the cell. Okay. And the powerhouse gives, takes the immediate pain away, so there's not that much inflammation from opening so long in a dental chair.
Right.
Also, when I work with patients, if I know they have TMJ or their jaw hurts, then I give them a lot of breaks. I'll give them more time. I'm like, okay, Mr. Smith needs, 2 hours of the appointment instead of 1, because we're breaking in between. We'll do a little bit of work and then give them a break and say, okay, let's just relax your jaw. So the inflammation's not as much. Also, when any new work is done, we grind a little bit more than we normally do, just for that few hours.
Yeah.
And so that can also cause a little bit of jaw pain. So all of this, talking to your patients, using some herbal stuff, some homeopathy stuff can help. Like arnica is a great homeopathic thing for, inflammation. Right. I love arnica gel and arnica oil. So I'll tell my patients, okay, go home and rub this a little bit because it reduces inflammation. Also, icing it a little bit helps. So there's so many different things we'll discuss with patients depending, again, how severe it is, how much pain they got. Right. So we can help them, use different adjuncts to kind of reduce the amount of inflammation they have after a procedure.
Well, procedures vary.
Yeah.
There's all different types of procedures. No one likes to go through a root canal.
No.
No one likes to have their teeth pulled. And I'm sure it's all about anxiety that's building in, as we talked about earlier. But I know there's a lot of sensitivity that occurs because of these procedures that are going on in your mouth. But what I wanted to ask you is what causes that sensitivity?
So you mean sensitivity in terms of thermal, or do you call it sensitivity versus just anxiety?
Sensitivity separate from anxiety.
Okay.
Anxiety we know.
Yeah.
Okay.
So sensitivity
yes.
with the temperature and stuff. So it's like anything in the body, right? If you get a little cut, you can get a little bit of pain, right? Mm-hmm. And the same thing with teeth. Teeth are not lifeless. Teeth have nerves. Teeth have, blood vessels. It has all of that. So after getting work done, a little bit of sensitivity, like right. thermal sensitivity or bite is normal. Because when you're numb in most instances, you're not going to bite and replicate exactly the way you bite when you're not numb, right? Because the muscles are not going to know where to sit, how to bite, how to come together. So it's very important after you get a filling done or crown done, if you get some sensitivity where you bite on something and it doesn't feel right, it's
Right.
important to let your doctor know,
Okay.
your dentist know, because we can adjust it. It's like the wheel of the tire. If it's off by a millimeter or so, you know, the shock absorbers are going to feel it.
Right.
The same with teeth. Similar concept. So it's important to know. Now, cold and hot after a new filling is done,
Yeah.
there is some extent of trauma, right?
That's what I was going to ask you
Yeah,
next.
so the
but-
tooth has a little bit of trauma.
Right.
So when it gets trauma, you have to let the tooth also calm down. So it's important that you talk to the dentist, you let them know a little bit of thermal sensitivity is normal after a procedure, as long as it's something that's going down after a few days. If it stays the same or goes above, sometimes the tooth needs a little more than what procedure was done.
Okay. Suppose I'm just, it's a normal day, and my teeth haven't bothered me, and I go get, say, an ice cream, okay? And all of a sudden I feel, ooh, that was really cold. It was like uncomfortably cold on one side of my mouth.
Yeah.
Is that a signal that something's wrong?
Yeah, so most of the times as we age also,
Not all of us age.
I'm still young, no, I'm
We
kidding.
get younger. As we get younger, we get.
But as we get younger,
Yes, as we get younger.
some of the gum does recede, and gum recession happens from, brushing too hard, again, grinding and clenching.
Okay.
It can happen from different variables again. But most of the times when you have recession of the gum, there's no enamel there, right? Enamel is on the top surface. It has
Right.
a very thin substance like enamel, but it's called cementum. Now, that wears out very easily from brushing too hard. So
Okay.
patients think, oh, the harder I brush, the better. But no, you have to, again, talk to your dentist. Hard toothbrushes, I don't like them. I always tell my patients, sensitive, use very soft and sensitive toothbrushes.
Okay.
Also, we're not, scrubbing pots. We're breaking plaque down. So when you break plaque down, plaque is a substance that grows on your teeth. It's almost like a spider web. In a few hours after brushing, that becomes almost like it recreates the spider web. So what do you do when we see a spider web? We just go with our hand or we brush and it comes
Yeah.
off, right? The same thing with teeth. You just need something gentle that's going to break off that spider web, which I
Okay.
call plaque. And then we have the bacteria and calcium and everything else, the foods, everything getting on there. We humanly can brush and clean as much as we can at home, but we're going to build up a little bit's going to calcify from the calcium in our saliva. So when that hardens, that's the buildup. You're going to your dentist and they're going to remove that physically with all the scalers and things like that.
Okay.
So that's important to remove because when that sits, the bacteria forms a biofilm and that under that, and that's more effective for the gum and stuff. So that's why it's important to go for cleanings.
Okay. One of the things I like to ask my guests, and this is not something we really prepared beforehand, so is I always like to ask them about somebody who was a role model,
Yeah.
growing up, and who's been a role model for you, or somebody that really made an impression in your life as you moved up in life.
So there's been a couple,
Okay.
but we'll talk about, since we asked about one person, one of the biggest people I really is a mentor, and I just love this person, was a dentist in Boston.
Boston. Okay.
Yeah. I was 18 years old. I was desperate. I wanted to do dentistry. I wanted to learn about dentistry. Had no other, thing that I had done, but I was like, no, I just want to be a dentist. And he was a dentist. He's an Italian guy, Dr.
Right.
Miriola. He's in Brooklyn, Massachusetts. And I went in with a pizza box. I didn't even know how to interview. And I said, look, I'm just passionate. I'm looking for a job, and I want a chance.
Right.
He said, all right, let's go. He gave me the job on the spot.
You like the pizza box, huh?
He liked the pizza box, but he gave me the job.
Yeah.
And not only that, but he was such a good mentor because I saw from him, he wanted to learn new things. He wanted to do new things. And he always cared about the patient. The person in his chair was his family.
Right.
And that's the same thing I feel. Every patient that comes in my chair, I always tell them, good, bad, ugly, you discuss with me. Okay? I don't want to know only good. because that's how I can help them. I
Right.
can't help them if they don't tell me, oh, Dr. Sawhney, I didn't like that. They need to let me know. And that's what I love about all our patients. He taught me a lot from there, that always look at, don't stop learning. He said, always learn. Every day you have to learn something new.
Right.
Every day you have to read something new. It doesn't matter how old you are, whether you're 80 years old or you're 20 years old. Every day is a new day. You learn, you learn, you learn. And he always told me two things. He said, never look back and never look too much forward. Look at today and enjoy today.
Good words.
And that's what I love. I always remember that. And I just love dentistry. I love helping people. And I do the best I can to do everything that I know today.
Okay. Before we finish up, two quick questions.
Sure.
What made you decide to become a dentist, and what advice would you have to anyone who's watching our program and thinking about becoming a dentist? And the last question is, why'd you pick Cranford to open up your dental practice?
Yeah,
What attracted you to Cranford?
Great questions. So when I was 5 years old, I lived in Africa. That's where I grew up. That's where I was born, in Zambia. And our dental clinics were, you only went if there was an emergency.
Right.
You went if there was pain. Other than that, you didn't have dental cleanings, you had none of that. I went with my cousin. And the treatment she got, as everybody's fearful of the dentist, I became fearful. And that day I said to myself, there has to be a better and easier way to do this. You don't have to have a 6'4" guy push you down in the chair, hold you down, and someone's doing work without anesthesia. There has to be a better way. And that made me strive. I'm like, I have to find what's better, easier for patients and how to relax them. And since then, I got into medical school in Zambia. I didn't want to go. I wanted to do dentistry. It was always like, that's what I want to do. Okay. And that's why I ended up in the U.S. I loved everything about the USA, how the education system is, coming from Africa. I love the fact that you get to explore, before you became a dentist, you get to explore pre-med and an undergrad degree, which I went to Smith. So I was a liberal arts biology major, but did, arts minor, because I love arts. I love creating things.
That's good.
So that's what I look in dentistry too. It was a good mix of science and art, and that's what I love, because you give a nice smile to a patient, and when they give you that feedback and they can smile and their confidence, that's a win for me. It's not always about the money. It's about, how did I make somebody's life change?
You changed somebody's life.
Yeah.
For the good.
And it's the best feeling. When a patient says, I can chew my food, I can do this, it's just, I can't tell you. It's worth like $1 million. It's just worth so much. And so that's why I chose dentistry. Okay. And I'm happy and I love it and I want to grow in it and do better and bigger things. Now, second of all, you asked me why Cranford.
Right.
So when I was working as an associate for the Holistic Dental Center, I always thought I need to do my own thing. I didn't even know Cranford existed because I'm not from Jersey. I know DC very well, and right. So my husband's born and raised in New Jersey. But I was driving by, and I'm not telling you, something in my heart said, Cranford is for you. So my broker came and said, there's a practice that's available in this town called Cranford. And I was like, where is Cranford? So I drove on Garden State. I am not kidding. The minute even before I took the exit, in my heart something said, this is your town. And I moved in, and the people of Cranford are the most amazing, down-to-earth people I've met. And I live in Millburn, New Jersey. Right. But I love Cranford. I love Cranford. People are very giving. People are very welcoming. Going through the pandemic, people cared about asking you, are you okay? Because a lot of businesses took a hit, including ours. Right. We were shut down for a while. Although I worked through the pandemic, I let my staff relax, but I kept working, seeing patients, because I knew patients needed me. I wasn't scared of it. And I knew we would find solutions to it, So I invested a lot of money in making sure the practice is safe, which is worth it because everybody's been safe in our office. but Cranford just welcomed us, made everybody feel, this is home. And that's how I feel. Even though I don't live in Cranford, I just feel it's home. And I have other practices, but I love Cranford. This is my favorite time.
Well, I really appreciate the time that you gave us today, and I do wish you the best. And so thank you, Dr. Jayshree Sawhney, for coming on, Healthwatch, and talking to us about all dental health and the importance of contacting your dentist and making those dental appointments as soon as possible. So that's our show for today. I'm Lew Goldstein. Thank you for watching. Make sure you contact your dentist. Get in there, get in the chair, and take care of your teeth, because your teeth will take care of you. So until next time, I'm Lew Goldstein. Thank you for watching Healthwatch. We'll see you again shortly. Take care.